Thank you, Jennifer. All right, thanks for having me, everybody. I'm super excited to be not only chatting with you all via office hours, but I'm also stoked to be your chair for this year. Heads up, Fancy is coming up soon, so just putting a little plug in there. If you're headed to Fancy, come say hi to us. We will be there. But yeah, so Jennifer, you put it so well. I think we've been really, or even Jennifer has been really strategic about what topics to bring in based on feedback. So I'm happy to talk about this today based on some feedback we got and needing a little bit of support. So thumbs up, right? We can see my screen and hear me. Everything's good? Yeah,
I can see it.
Awesome. Okay. So this is going to be a quick review. I'll be honest with you guys. I could probably talk about this for hours, but for time's sake, I'm doing a quick review today for the purpose of office hours and more importantly, creating tons of space for questions. So yeah, let's get into the quick review about how we as dietitians fit into the role of body image topics with our clients. So the question is, where do we fit? And some of the things listed here are actually literal conversations I've had with people or have heard providers say when it comes to the role of body image and how it gets addressed. For example, a lot of us have heard like, oh, that's actually the therapist's job. You know, let's just redirect all of those conversations to the therapist. I've also heard, I don't think that's in our scope of practice. So I think we're supposed to be pretty hands off there. I've also heard things such as like, you know, am I even allowed to talk to patients about this? Am I overstepping my boundaries if I do that? But then there's also the question of who even gets educated on body image counseling techniques and things like that in school. Sneak peek, not many of us really. I think as dietitians, we get pretty much 0 or -0, and therapists might get a class on specific body image techniques, but a lot of providers are actually doing this continuing education outside of entry-level positions because it is something that you really want to be savvy with before you dive in. And then lastly, something else I've heard kind of dietitians say before is like, but if it doesn't relate back to food, I don't think it's in our scope of practice. So how does it relate to food? Does it relate to food? So I just kind of want to go through these and talk a little bit more about it. So let's take some time here. I know that there's a lot of writing, but it's important. So there's a bit of a blurred line when it comes to who is doing work with our clients on body image. The blurred line exists between us as dietitians and other mental health professionals. So the question is, how do we bridge the gap? Where is the line? What is the line? Is it a hard line? So let's just first start with us and the dietary practices. So I've really separated it here to be what the dietitian should be focusing on and what the other mental health professionals should be working on. And we'll get to the below part in a second. But as registered dietitians, we always need to keep in mind that when doing body image work, the focus should be on the role of body image as it's related to the client's intake. Okay, so as we're getting understanding of current intake, eating patterns, etc., if there are relation to some of those negative body image thoughts when they are consuming or intaking this food, then it's very much our place to talk about it. It's also our job as registered dietitians to help clients challenge the distorted beliefs through education. Now, one thing I think we all can agree on is that we all have to take human anatomy. We all have to get a little bit of that biology, whereas many therapists and many mental health professionals may not. So when it comes to weight regulation science and the human anatomy portion of it, we actually really are the best people, believe it or not, to dive into that with our clients, especially when it relates to facts, right? I think in therapy, some things are very gray area, but we get to step in with some of the facts that are a little bit more black and white to say, this is really how the body works. And then lastly, the dietitians want to make sure that all conversations and exposures are aimed at helping the client improve their relationship with their body, food, and movement. And to think that you would talk about food and movement without talking about the body is almost impossible. So we find that it's kind of a cocktail of the three of these topics that come up in sessions that basically require us to bring it up and to have the uncomfortable conversations. So, okay, if we're talking about, all right, who does the rest of the stuff? What do the mental health professionals do? Let's talk a little bit about what their expectation is. And this is, thank goodness, adapted from a provider who I work very closely with as an LMFT to kind of consult with and, make sure I have a good understanding of what their expectations are. But basically, the person working alongside us is focusing on negative thoughts, maladaptive behaviors as they arise directly related to disordered eating. So both of those topics, negative thoughts, maladaptive behaviors, seem to be one of the main focus in therapy sessions. And then the therapist is also a good person to do exposure work around shopping. Some people do like a gene exposure, mirror work. Those I would confidently say are not in our scope of practice. Mirror work, right? There are also work around body reflections and body checking. Some therapists have literally a mirror in their office to pull into sessions if they need to do some of this exposure work. And because of their savviness to techniques of emotional dysregulation and all of those kind of fancy things, we really do want that stuff happening in their office. So they're there to support right there in the moment if they're struggling. But the therapists are also exploring where they got these messages from people in their lives, family, childhood, social media, any other external factors that might have shaped their view of the world or even shaped their view of what is quote unquote normal when it comes to body shape or size. And then lastly, thank goodness we have therapists on our teams oftentimes when we're working with folks who have pretty significant negative body image, because they're the people who can dive into some of the deeper stuff, such as trauma or anything that might have created or kind of exacerbated disconnection between mind and body. And obviously, as registered dietitians, we certainly can be trauma informed, but we are not actively treating the trauma, right? Where thank goodness we have our mental health professionals who can dive a little bit more into that. One of the questions I often get is like, what if your client is not working with another mental health professional? It's time to get them one, right? I don't think that only the mental health professional or only the dietitian can do this work. I truly think it's a team approach. And so whether that's, a frequency of once a month, once a week, whatever the patient needs, we just want to be mindful of, are they getting everything they need? Or is there another provider that we can tack on to their treatment team to make sure that they're getting it from all angles? But here's the blurred line. The blurred line is that we're both trying to set goals to challenge negative body image. And so make sure if you are working with another professional, excuse me, make sure that you understand who's taking the lead on exposures, right? Typically, the RD is taking the lead on food exposures. Typically, the therapist is taking the lead on mirror work and other exposures, but really lay it out and make sure that the goals are related, are on the same page. And more importantly, that the mental health professional shares the same nutrition philosophy as you. Because if not, that can actually be a barrier to making progress and getting good outcomes. So eventually, working successfully, a client with both a dietitian and a mental health professional on the topic of negative body image, eventually the goal is to get to a place where the RD can focus solely on eating, right? Meal plan compliance, eating every 2 to 3 hours with foods that are both physically and psychologically satisfying, while the therapist is working on tolerating, right? Helping the patient tolerate any discomfort that arises from following the meal plan, from eating every 2 to 3 hours. And if that uncomfortableness or discomfort is related to body image, here we are again with the blurred lines, making it a team approach. So I want to pause here. Let's see, is it a pretty big group or is it a smaller group where I could pause and ask questions?
There is about 20 of us on here, but actually I was going to see if you just wanted to answer this one question just real quick.
Sure, yeah,
So,
let's do that.
Somebody messaged me privately and asked, what if the therapist is not willing to do the exposure work of shopping, mirror work, etc., even if they specialize in ED treatment? What would your steps be there?
I've been working in eating disorders for 8 years, and that surprises me because I think a lot of therapists who specialize in working with body image do so because they're equipped, their tool belts are equipped with some of these interventions and techniques. I would politely ask the therapist what techniques they are using, and maybe they are using techniques outside of exposure work that they're finding great outcomes and effectiveness with. That's tricky for me to understand because there's just such an overwhelming abundance amount of research related to exposure response prevention and how highly effective it is, specifically for patients with eating disorders, OCD, etc. So part of me would think there would be a missing piece if we didn't loop in that abundant research about exposure response prevention. But I'm also open to the idea that some clients who, for example, are severe and enduring might need a different approach or have already exhausted all the exposure work in a treatment center where they are still not getting the outcomes they need, where they're needing to focus on something else. So I would just get curious with that therapist and see what techniques they do use and see if y'all can get on the same page with those goals. And if you're feeling, I think as dietitians, we have good gut feelings. If you have that gut feeling that they're just really missing it, maybe you can have that hopefully collaborative conversation to talk a little bit about ERP and maybe how ERP can fit in both the therapist's office and your office in some type of way. And then of course, more importantly, if it's just not a good fit, then finding someone who is a good fit. But I try and work with the provider as much as possible to see, what techniques they're using.
Okay, there's a follow-up. I don't 100% know if I'm interpreting this the right way. So if they're working on therapy on things outside of body image, but they want to come talk to the dietitian about body image, that's what their focus is on your conversation. Are you comfortable? I think what they're asking is, are you comfortable kind of taking the lead on body image if that's not something they're willing to work with the therapist? And this is an anonymous message to me. So y'all do remember that we'll turn the recording off. And if you feel more comfortable having a conversation after that, that is definitely a possibility. Or you could shoot me another message and tell me she said yes. So that's what she meant.
So I think what I'm hearing is, what if the client is working on other things with the therapist? And so in order to start doing that work, they've been recommended to work with a dietitian on it. And if that's what I'm hearing, I would respectfully respond with a response that looks like, yes, I'm happy to spearhead this. However, I don't think we will get nearly as effective outcomes without having some type of goals or intentions in the therapy office as well. I think there can be, and I've seen this, I think there can be a little bit of misalignment sometimes if all body image work is deferred to the dietitian, because then we're really missing the like part about tolerating the discomfort that comes with talking about it, right? We're skill informed. We can encourage our patients to use coping skills and ask them what their go-to ones are and even set goals for them to use it. But the therapists are really the ones doing the psychoeducation and recommendations about what are the effective ways to tolerate this discomfort? And we really need that from them. So maybe at minimum, if you were to take on a patient who perceives getting most of the body image work from the dietitian, at minimum, making it very clear among client and therapists that we will need the therapeutic support with skills to tolerate discomfort while they work on this with the dietitian. Because I just think without that piece, I've really seen things, get stuck and stagnant in body image work. So yeah, sorry that wasn't clear cut, but that's kind of where my head's at.
I think this whole conversation is going to have a lot of caveats and stuff.
Yes, lots of gray area caveats. I mean, hence the blurred lines.
And she said thank you, that validated that she felt a little off about a situation. So
Good.
I think if we're good to move on, and then we can interject or we can wait until the end, just depending on what the questions are. Is that good?
Beautiful.
Okay.
Thank you. Yeah, we'll keep moving. So let's talk about the how. We've talked a lot about like who should be doing it. You guys have asked wonderful questions. And so let's talk about the how now, because this is like the juiciness of it all. Oh, just kidding. My computer decided no. Okay. So let's start with treatment modalities. So for treatment modalities, we've got a nice little bundle of them that as dietitians, we can lean on. The first one is getting very familiar with ASDA, which stands for the Association for Size, Diversity, and Health. They have a wonderful database, specifically divided into different categories actually on their website. For if you want research related to quote unquote obesity, go here. If you want research related to weight regulation science, come here. If you want, so they have a beautiful database on health at every size approaches and other complementary studies that help guide our recommendations. And so I highly, highly recommend using ASDA as a resource. Please know that health at every size is trademarked. So if you are someone who is a HAES provider like myself, it's important that you are not taking ownership of that approach and that you are using that approach and borrowing it from really the Association for Size, Diversity, and Health and bringing that connection to our clients to learn a little bit more science behind weight, health, etc. And really, if you're on this call today and you're like, I keep hearing about this health at every size thing, like, what is this? The number one misconception or misunderstanding I get about health at every size is that it's healthy at every size. Those are two very different things, health at every size and healthy at every size. Healthy at every size is saying you're literally healthy at every size. That's actually literally not what we're saying. Health at every size means everyone of every shape or size deserves to practice health promoting behaviors that will actually improve their health without a focus on weight. That's what health at every size is. So if you have a misunderstanding of it, it might be a good reminder today to maybe look a little bit more into this approach to make sure you have a good understanding of how this is positively impacting our clients when it comes to body image.
And I think that's a super important statement because like my introduction to health at every size was not positive. From dietitians and groups that I don't need to get into all of that, but it was not a positive experience until I learned more about it and took on the what is the word I'm looking for? Basically to go learn about it a little bit more rather than how these conversations were going in some of the Facebook groups. So. Yes. Thank you so much for sharing that, Jennifer, because I think that's why I paused with this one is because I understand that not only is there a level of controversy, it's because of the misunderstandings and the way it's presented incorrectly in some arenas. And so again, I just want to say it one more time. Health at every size means that everyone of every shape or size deserves and can practice health promoting behaviors that research shows will actually improve their health without a focus on weight. Weight is not a behavior. And since weight is not a behavior, it cannot be the end all be all focus of behavior change. Whew.
moving on. Body respect over body love. Okay, so the reason I got that little sign there is because we've made a shift in body image work. There, I think probably more than a decade ago, it was like, love your body, look in the mirror and shake it and just love it. But more and more research has come out over the last decade that has showed even those with quote unquote good body image still have bad body image days. So there's actually no such thing anymore, or there's no research supporting that there is such thing as perfect body image and that we all just love ourselves in every inch of it. Research does not show that. So can we actually create a little bit more realistic goal for the finish line of body image work to be more of body respect versus body love? Now, please, if your patients have outcomes of loving their body, hallelujah, right? That's great. And know that sometimes the first step is just garnering respect for the body, which oftentimes is feeding our body, right? Drinking fluids, moving our bodies in a way that feels good, et cetera, getting adequate health care, going to your healthcare appointments. There's so much more to health in the body respect realm versus just love your body. There are some resources out there about body respect, but again, I think your best resources are going to be from ASDA. And this is one of the people I'm kind of quoting right now is on my resource page at the very end. But one of the kind of top body image therapists really in the world, believe it or not, and is most recognized, I think she's from Australia. It's on my last page. This is what she says. She says that, look, a lot of times, this is how body image works. We start here where it's like, I hate my body and I don't respect it. And then you get to a place where you still don't like your body, but you do respect it and you do know what it does for you. But then you get to another place where you're a little bit more neutral about your body, but you're damn sure you're going to respect it. Guys, that right there takes a lot of time just to get there. So think of this as a long-term process that your clients are investing in that is going to ebb and flow throughout their lifetime, right? Because our bodies are changing, they're meant to change, and we're dismissing old ways of thinking of, right? The lady at the wedding who might be even, let's say 50 years old saying, I wish I fit in my high school jeans. Eek, scary. So we're moving away from that, dismissing that as abnormal. And what's actually normal is the idea that our bodies are shifting and changing over time, and that the weight that's well for you now may not be the weight that's well for you in 5 years from now or 10 years from now, and just seeing it as more of a moving target versus some type of thin ideal. We want to make sure we're using a weight inclusive approach, which means that we are removing moral value from shape or size. Okay. Our society, unfortunately, and yes, this is confirmed via research, our society has a very, very high moral value for thinness, right? Unfortunately, over a lot of our lifetime, we have been fed information that thinness is ideal, of utmost importance, equals health, et cetera, et cetera. But unfortunately, what that did over all of these years has created a level of oppression for people who did not fit in this quote unquote thin ideal, whether it be genetics, whatever, lifestyle, blah, 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 blah. And so because of this, we've recognized that these oppressive experiences, these weight stigmatizing experiences actually act as trauma. So I went to the IADEP conference 4 years ago, and that was kind of like the keynote talk of that conference. IADEP, just for those of you who don't know, is the International Association for Eating Disorder Professionals. And the keynote speaker started making it very well known that weight stigmatizing experiences that our clients have act as trauma, therefore needs to be treated as trauma within therapists. And so again, being trauma informed, removing moral value from shape and size, and seeing every body, shape, size, etc. as morally equal. Fat activism. So you cannot, and I could probably say this a million times, you cannot do body image work without doing fat activism. You just can't. In order to do true body image work, you have to be an advocate for this idea that bodies exist in different shapes or sizes, and that fat on the body as a neutral term is normal, needed even, and will shift and change throughout life, and is influenced by everything from genetics, prior disordered eating, current disordered eating, etc. There is no form of effective body image work that exists like this. So we're going to talk about body image today. And just so you know, you're not fat. You're not fat, just to be clear. Wrong. No effective body image work exists by reassuring a patient they are not quote unquote fat in the stigmatized version. Good body image starts with neutralizing the word fat, using the word fat in your verbiage, and creating a more neutral, inclusive approach, and almost even more so advocating for folks who might have been oppressed by the thin ideal values that have sadly been kind of in and out of our society throughout time. And then lastly, the trauma-informed approach means that you are mindfully and thoughtfully aware of what type of traumatic experiences your client has been through in relation to body image. For example, I worked with a client who was in the military, and this client had developed a traumatic experience in which they did not pass the exam due to their weight that was called out in front of all of their colleagues, which was then a very shameful experience. So because of that, when working with this client, I am extremely thoughtful on how I bring up this topic, what verbiage I'm using, what possible experiences in their past have shaped their view of this topic. And so just being extremely thoughtful, not to go on your typical registered dietitian spiel, but to be mindful of what the client in front of you has actively gone through. And now that we've all identified on this call today that weight stigma experiences act as trauma, ask your patients, have you ever experienced weight stigma in your life? When? And sit in the uncomfortableness of those experiences and recognize it as traumatic and recognize it as something that's going to take time to move through. Okay, let's talk a little bit about other techniques. So these are like a little bit more specific, I guess. My favorite one is role playing. And you're like, okay, what does that look like? Typically, this comes into play when a patient has social anxiety related to negative body image, right? I work with many clients who say, I literally don't go to social events because after I'm done getting ready, I'm like, I can't show up like this. How can I look like this? And so doing some role playing acts as exposure therapy. Role-playing conversations and how they would answer them, role-playing how they would respond when someone makes a body comment to them, right? My favorite mantra is like, there's no good reason to make a comment about someone's body ever, like literally ever. And so if that experience happens, how can we respond? Did you have something, Jennifer?
I was just gonna say also what they're eating.
Yes, that too, right? Add that in there. And we've got a special guest back here. Sorry about that, my cat Bouge. He's into the combo right now. So one-on-one role playing. My favorite one is, when my clients are saying, Theresa, I've done all this good work with body image with you, but as soon as I leave sessions with you, I'm like right back in negative body image land. And so we'll in session role play what it feels like to be out of session. And I'll pretend to be the distant aunt at the wedding who they don't see except for once a year that always makes a comment about their body. And I'll pretend to be that person, right? So I'll be like, hey, Jennifer, and we role play. Oh, it looks like, oh, are you pregnant? Or no. And we role play how uncomfortable those experiences can be, not so that we hope they happen, so that, gosh forbid, if they did, we're at least coped ahead with a response, how to cope with it, and separating any moral value to the conversation at play. So that can be really helpful. Weight regulation science education is huge from the dietitian. I highly recommend Poodle Science on YouTube. It's a really great health at every size video created by ASDA, and it does a beautiful job. And even though it's cutesy, it's a cartoon, I've showed it to everyone, such as psychiatrists, physicians. I've had a doctor dinner with 30 doctors and shown it. So just because it's cutesy doesn't mean it doesn't have a really great point. And so show your clients this video, and it talks a little bit about what the heck we're talking about when we're talking about health and how weight even fits. And sneak peek, the video is really explaining how weight is only one small piece of a very big picture. If we've got 30 indicators of health, weight is one. So what are the other 29 if we're not focusing on weight? Mourning the loss, letting your patients cry, letting them be upset, and not trying to save them from it. Because if we know one thing about mourning, it's that it's not easily switched off by a quick education. So sitting with our clients in this idea that if they are mourning the loss of this idea of a body they wish they had or even used to have. Sometimes I have clients who are like, this picture from 10 years ago is haunting me and this thin body I used to have. We actually consider that process mourning. And so how can they leave behind that idea, but still mourn the loss of something that was really difficult? We want to remove any and all negative reinforcement. And that's all the way down to like billboards, taking a different route home from work, like no joke. We can get real picky about how we surround ourselves, because that's a choice we get to make, and our clients can make that choice to protect themselves too. I have the example of Think Thin bars is because I worked with a client for about 3 years, did amazing body image work with myself and the therapist. And at the very end of it, I was like, there's just one thing that's bothering me. I'll call them Susie Q. There's only one thing that's bothering me, Susie Q. You still eat those Think Thin bars. Yeah, Theresa, I just like the taste of them. They're not that expensive. They're like the first thing I see at the gas station. But we talked about that a lot. And it wasn't until probably a few months after that client said, you know what? I think I get it. I think I get the message it sends me every time I open that Think Thin bar, AKA the subconscious back in the amygdala, think thin. So how can we remove even some of those things that may not seem super pertinent out of our environment to fully submerge ourselves in health at every size? Because if you're only like dipping your toe in haze, but everything else is kind of in the thin ideal, it's going to make for a really confusing and frustrated kind of experience. Have them rate. So oftentimes, you know, dietitians, we want to know if progress is being made. How do we know progress is being made? Have them rate on a scale of 1 to 10 with the SUD scale. SUD stands for the subjective units of distress scale. Have them rate it. On a scale of 1 to 10, as we get started with body image, when you think about your body, where are you at? 1, manageable, I don't really even care. I feel fine about it. All the way to a 10 where it's like, Theresa, even talking about this right now gives me distress. Where are you at? Okay, we're at an 8. Every few months after we meet, every few months, we're going to rate it again. And what's cool about that is you can see the rating go down, 8 to 7, and then sometimes it peaks up, right? They have a breakup, goes back up to 8, and then it goes down to 6, and then 4, and then a happy 3, because there's really no such thing as 0 per research. So just helping them celebrate their progress. Normalize feelings, validate societal stigma, right? When the patient says, I just feel like everyone wants to be thin in our society, you can say, well, there's some validity in the societal stigma around weight, right? Or that might feel normal, especially with the traumatic experiences you've had. And don't save them from emotions and just sit in it with them. Wow, Susie Q, that sounds like that experience really sucked. I can't imagine how that felt. And just sitting with them in it. Some do's and don'ts. Please do check your biases. Harvard.edu has a wonderful weight bias test that you can do. If you're someone who works on a treatment team, I recommend giving it to everybody on your treatment team. No, you don't have to turn in the results. It's just for you individually, but it tells you where you fall on the biases when it comes to weight. If you have any privileges, making sure to state that, right? I will never, ever, 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 ever be an expert on the lived experience of someone who lives in a larger body, let's say. Never. I could do 10,000 CEUs on it, but if I don't have a lived experience, I'm never the expert. So making sure that you and your client understand that you're the helper, not the healer, right? Neutralize the word fat. Don't make it a monster under the bed. Remove words such as obesity and overweight. Yes, I understand they're still used in clinical verbiage and even in your charting systems, EMR systems. But when it comes to patient-facing care, even more importantly, more and more research is showing negative experiences with this verbiage of categorizing based on shape or size. So let's ditch it and remove it out of our vocabulary when working with our clients. Be non-judgmental. Advocate for weight inclusive care. So if you have to call up that doctor and let them know that it is possible for their A1C to decrease without weight loss if they focus on decreasing binge eating behaviors, then do that. Normalize the body's meant to change and practice regular positive conversations that have nothing to do with body shape or size, actually, like nothing. You know, all those other important things about us, no big deal. Do not assume someone's lived experience. I've had patients who've come to me and said, I truly don't think I've ever experienced weight stigma ever. Okay, we don't have to say you probably have. No, well, let's talk about it. Don't avoid the word fat. Remove stigmatizing language. Make sure we're not, right, reassuring patients that they're not going to gain weight or that they're not going to, you know, be fat one day. That's not supportive. And some resources. These are just some of my favorites. I love the body positivity card deck. I'll use that like at the end of sessions to wrap up the last 10, 15 minutes. There's some books specifically on body image for BIPOC folks, which I think is very important. The Intuitive Eating Journal loops in some body image stuff too, as well as the card deck. And then there's a wonderful workbook out there called Your Body Is Not an Apology, which is another good resource for clients. And then for social media, here's a little list too. This top one right here is, I think, the one I mentioned from Australia, who is very well integrated into the body image work, both science, community. And that's about it for you guys. Hopefully that was helpful.
That was awesome. Something came across. Someone said, thank you for explaining the Hayes distinctions. And then a question to clarify is thoughts on if a CED-SRD would be appropriate for some of those exposures that you were talking about way back earlier.
Yes. Yes, 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 yes. I would say if there is any dietitian specialty that is more equipped than others, it will always be your CED-RD. Yeah. Especially CED-RDS.
Okay, guys, I'm going to stop the recording real quick so people feel a little bit more comfortable, and feel free to turn cameras on, mics on, that kind of stuff for the question part. We've got about 15 minutes left to do that. All right.